रजी साहब आदाब से कैसे हैं आप? ठीक ठाक हैं?
तो सर
बढ़िया से सब फर्स्ट क्लास है, अल्हम्दुलिल्लाह सेहत ठीक है. He had an intractable pain. He had been to many other hospitals, and that's what he was saying, that he is feeling much better now. Though the power is not there, though the bladder bowel control is not there, but the pain has gone absolutely. That's what he was saying.
अगर थोड़ी तकलीफ भी हो ना, तब ये छोटा बच्चा उठा लूँ, गोद में रख लूँ, तकलीफ दूर होती है.
We have a very far-flung areas to reach out. Capacity building is very important in the peripheral district hospitals. In this context, we have already trained 2 medical officers, 2 doctors and 2 nurses in each district. So we have taken the 10 districts. We have 10 districts in Jammu division, 10 districts in Srinagar division. So in Jammu division I am talking about, we have trained 20 medical officers from 10 districts and 20 nurses from these 10 districts. Basically, we want to brief you of what about the palliative care is and what are our achievements.
Palliative care is a very important aspect of health services, and we have been working hard on this since its inception in 2019. It was started in Jammu division, and since then we have made a lot of progress, especially in this Gandhinagar hospital.
So I don't want to go into the depth of everything. So what is more important is implementation of this scheme. When we started with our CTC program, we asked the government for the permission for undergoing a CTC program, and the government was very liberal in giving the permission to undergo CTC program. And it's not only the permission given by the government itself, our local authorities like Director of Health Services as well as the Medical Superintendent of Gandhinagar Hospital.
Our hospital has been chosen as the nodal center for one of the top hospitals of northern India for palliative care capacity building. These 10 hospitals will train 10 additional district hospitals. So we are training district hospitals, 2 medical officers, 2 doctors and 2 staff nurses for this hospital. In fact, in 34 years I have found as a general surgeon that many of patients who come with cancer, advanced malignancies, we can't do nothing for that. We know a stage 4 disease of cancer, we can't cure them. Their longevity is just 6 months to 1 year. So here comes the role of pain and palliative care. I think this is the place where they get solace so that they get a peaceful time during their last time. A patient who has life for just 6 months, I have seen with palliative care, they do survive for even 1.5 to 2 years along with chemotherapy. So once the palliative care services started in Gandhinagar Hospital about 2 years back, I was one of the few persons who became very happy, at least something has happened, and now it has evolved.
Life on mountains is not that easy. If a person is suffering on the interior area of mountain, it will be very tough for him to come to the center place like Srinagar or Jammu. It will be tough for them. So it is always better that we should teach and train doctors over there so that they can be taken care. In terms of palliative care, they will be looked after in their own places. So this is the thing which attracted that definitely this has to go to the periphery and doctors and nurses should get trained.
Basically, it all started with the pain concept. We were running the pain clinic here, and it was easy to accommodate the palliative care as a concept with the pain. So because pain and palliative care are together like amalgam of the things. CTC3 was, I tell you, one of the marvelous times that I had spent here. It was full of enthusiasm that we were going through a new course. More so, the most important thing is a new concept of learning. When we talk about the palliative care is that it's a part of the medicine. It is a part of a common sense.
Yes, it's a big relief because since the time treatment is started by sir, he has given complete guidance, ma'am, and very good treatment because he was suffering from unbearable pain. But now at least pain has lessened significantly, ma'am, and it is under control. It's manageable, ma'am, manageable. Being in hospital, patient gets demoralized and psychologically he may give up. But by being at home, getting palliative care at home, every member of the family can stay with him, care about him, give him support, emotional touch. So it's an important aspect that I feel besides that relief from pain for the patient.
हो गया 3 चीजें. चौथी चीजें बैक में और जो ये प्रेशर पॉइंट्स हैं इनमें आपने we had the interaction with nurses and the interaction with doctors also. The doctors had come all over India and from all premier institutions also. The one-to-one interaction with the doctors, most important thing is that in CTC3 itself was breaking up a communication barrier. B positive or accepted. A lot of barrier was there how to communicate with the patient, because as a doctor we had learned how to communicate, but as a doctor I learned how to communicate empathetically. I was communicating with the patient sympathetically, but now I had learned the art of communicating empathetically. There was a lot of exchange of thoughts, lot of exchange of perceptions, and that did very well. My nurses are my backbone in palliative care services, and both are very well trained in CTC itself. They're how to take care of the wounds and how to take care of the tracheostomy tube and how to take care of the bed sores and how to take care of the mouth hygiene, everything. Multivitamin भी एक दे देता हूँ। और कोई तकलीफ तो नहीं है आपको?
हम बिल्कुल चेंज ही हो गए। हमें अंदाज़ा ही नहीं था कि हम मतलब ये सब कुछ भी कर सकते हैं। हमें लगता था खाली ट्रीटमेंट दिया, इंजेक्शन लगाया, वार्ड में राउंड किया, बस यही। ट्रेनिंग के बाद हम बिल्कुल चेंज हो गए। हमें ऐसा लगा कि
लाइन
हमें
चेंज होगी ना हमारी, जैसे हम ड्यूटीज़ करते थे दूसरी, जैसे गायनी ड्यूटी, मेडिसिन ड्यूटीज़, सर्जरी ड्यूटीज़ ये अलग है। ये पैलिएटिव केयर अलग
है कि जैसे हमने एकदम से खुद ब खुद हमें हमदर्दी सी आ जाती है और हमें भी बड़ा अच्छा लगता है काम करके।
अगर
इतना अच्छा लगता है
पेशेंट
कि
बेचारा पेन लेके आता है, तो जब पेशेंट अभी देखो पेशेंट ठीक होके गया तो हमें भी हुआ कि अच्छा ट्रीटमेंट हुआ है, जब हमने अच्छा बिहेवियर किया पेशेंट के साथ।
दुआ हम दवा देते हैं, ये हमें दुआ देते हैं, ब्लेसिंग ब्लेसिंग ब्लेसिंग। खाली हमारे वार्ड में खूब सारी ब्लेसिंग।
जहाँ दुआ काम नहीं करती है वहाँ दवाएं काम करती हैं, और पेशेंट भी हमारे लिए पता नहीं कितनी ब्लेसिंग देखे जाते हैं।
In general, all over India, there is a big gap between doctors and nurses. Nurses think that whatever doctor has said, we have to do that. That just carry out the orders. We can do better. So we try to fill this gap as much as possible, and there should not be any gap between doctors. And ultimately, it's a team.
She wants the mountain range. I want the lake range, because they're also hidden. And in my lifetime, that's going to happen in Kashmir. I've been a nurse for 49 years. I am a nurse specialist in palliative care, but I've been an oncology nurse all my life. I think also one of the nicest things about the Lien Foundation and these CTC programs is for the nursing faculty to be trained further, gives them more encouragement. It empowers them truly so they can start talking about it. So Lien Collaborative is more open, so we can integrate ABC into it and make it a more complete picture.
The frontal, temporal, saphenous, these all bones are involved.
The fresh CT again shows
Yes.
I have personal experience because my father died of stage 4 cancer in 97. It was one of the rare tumors. And as a surgeon, I got early surgery done. We got his tumor removed, but within a week's time, he developed metastasis, severe metastasis. Ultimately, we had no answer, and he died after 3 or 4 months after detecting. So at that time, even when my brothers asked that you could have taken the patient to Tata or something, we were like that. But I, as a surgeon, I knew that we could do nothing. And because it's an adenocarcinoma with stage 4 metastasis, pulmonary metastasis, and cervical lymph nodes are also involved. At that time, in 97, there was no palliative care service at all in Jammu and Kashmir, and not even in India.
These are our 10 district hospitals. We are providing palliative care services in different hospitals, and they all have been inaugurated and they are functioning right now. I'll say I'm totally involved into the palliative care. Since I did my CTC3, we are doing totally palliative care now here. I have been accommodated on many of the international and national platforms as a faculty and as a speaker, guest speaker on palliative care, particularly on the cancer pains, and we are doing very well with this. But the most of all, I'm very satisfied that I'm giving happiness to few. I'm not giving any false hope to the people. I'm giving a supportive care at the terminal stage of the patient. That is definitely rendering me a very, you can say, the satisfaction to my soul. अभी तुम्हारा 5 मिलीग्राम चल रहा है मॉर्फिन, 5 मिलीग्राम मॉर्फिन 4 आवर चल रहा है ना?
मैंने देखा यार, they require a very sort of,
है ना सर?